may have seen him on Berkeley or Richmond Cable TV 28, speaking about depression, allergies, carpal tunnel syndrome, and everything else that you could think of in the health field. Dr. Jay has extensive medical background, including working as a surgical assistant when he was 18 and translating Japanese research on cancer for the National Cancer Institute in Philadelphia before moving to California in 1983. So here he is.
Thank
Dr.
you,
Jay.
Dr. Jay. So Lily is going to pass out your little medical files here that you can use to follow along in the lecture. So I also want to thank Shilpa, who is not here today, for giving me the opportunity to speak. So my purpose is to help as many people as possible achieve maximal health and vitality so that they can achieve their goals and purposes in life and to have a joyful and a productive life. So let's see, this is some of my background. Here at NCI's National Cancer Institute, I worked as a senior information analyst there for 5 years in Philadelphia before moving out here to California. So let's take a look at some of the obstacles for health for most people. More than 80% of disease and illness can be due to 5 main factors. Those are traumas, which cause a blockage in blood flow, oxygen, and cerebral spinal fluid. Everyone know what that is? It's a fluid that flows around the brain and the spinal cord. This is one of my recent patients I brought here as a demonstration. This is the brain. This is what a brain's like. If you want, you can pass it around. This is about the size of a brain. I've done classes where we actually work with real brains and we help them, and it feels very much like that. So traumas, toxic load in the body, and most of that is stored in fat because most toxins are fat soluble. This is 5 pounds of fat here, and if you want, you can pass that around too, but it's sort of nasty smelling, so I wouldn't touch it myself. Being overweight, stress responses, and inflammation. So my purpose is to help people and companies achieve optimal health and vitality, as I mentioned. Thus, at the Redwood Clinic, we also offer company wellness programs that address these 5 different issues. It's called Wellness Improvement Now, and the information is in your medical file here along the side. All right. There's this flyer. So this program is integrated with in-office risk assessment screenings, lunch and learn talks, obesity program, ergonomic stretching program, and cost reduction tracking in order to see how effective it is. As you know, obesity, that's interesting. Okay, so this is there's a slide that should be in here about obesity, but this is also in your lecture notes on the back side of the corporate wellness flyer. In several companies that I've worked with, we do screening to see how healthy the population is. And if you look at this chart, you can see a lot of red on here. Red is not good. Green is good. Red is not good. These results show the generally abysmal condition of California employees, in spite of the fact that California is considered to be a very healthy state. I was rather surprised. Now, of course, 70–80% of people in the U.S. are obese, and in many of the companies, this is the case as well, overweight or obese. And this is one of the big causes of health problems in this country. So I also do educational talks on various health topics in the natural medicine perspective, and I do have a list in here on this side too, behind the corporate wellness, of the various topics that we do. A number of these have been recorded, edited, and are on public access television in Berkeley and Richmond. But if you know of any organizations, a church or some other, or a company who would like to have me come in and do the talks, I do it as part of the Foundation for Wellness Professionals, and it's a voluntary thing, so I don't charge for that. All right, so let's do a quick survey. How many of you use your muscles primarily for your job? Stand up, please. Primarily. Yeah. All right, well, how many of you actually rely on your brain more for your business? Raise your hands. Well, it's the vast majority here, and that's difficult. Let me tell you this, it's actually an uphill battle to save your brain nowadays. And this is because of stress, environmental toxins, traumas that occur. People maybe have been in car accidents or falls. That can cause a diminished flow of blood and oxygen to your brain. Inflammation and obesity, they're all key factors here. And diabetes is an inflammatory condition. And obesity is an inflammatory condition. So those 5 factors I mentioned are always there, causing your brain to break down. How many of you know somebody who has Alzheimer's? Raise your hand. Anyone? All right. Sorry to hear that. How about someone with Parkinson's or MS? So on your progress graph here, I want you to check off the spot here. If you know of anyone with Alzheimer's, Parkinson's, MS, or dementia, just circle those. Now, how many of you ever have any trouble remembering names? Raise your hands. I know Bob doesn't. How many of you go in the next room and you suddenly realize, why am I in here? I totally forgot why I'm in here. You had that experience? Circle here on this progress chart. All right? So, given that your brain integrates your mind and your body, what is your brain worth? I want you to write on your chart how much you think your brain is worth. Just write down a dollar amount there on your chart. All right, well, I bet many of you actually said your brain is invaluable, right? Because how can you put a price on that? So let me give you an example. So if you had to have a brain transplant, now I know Bob's has a knee transplant and things like that, or a replacement, but if you had to have a brain transplant, which one would you choose?
Oh, hey.
And what would your life be like if you started losing your brain functions? So which brain would you rather have? One of these? Or 2 of these? So brains matter. Your brain matters. And there is an interesting quote. "'Tis better to be silent and be thought a fool than to speak and remove all doubt." That was by Abraham Lincoln. So did you decide which brains that you would prefer to have if you could have a brain transplant? Well, I'm just going to give you an illustration of a patient of mine, and we're going to call him Nelson. He's a wonderful multilingual man in his mid-30s, and he supports his family through a husband-wife family business in Richmond. He has also sent the rest of his family to me before in the past for treatment, and so he finally ended up coming in because he comes in with tremors, difficulty starting his walk. He like wants to walk but he can't, and then he starts going. Difficulty finding words, difficulty remembering, having a hard time showering on his own because he can't get his body to move. He's like, he gets stuck in the shower and he tries to move and it's very difficult to move. 2 years earlier, he underwent chemotherapy and surgery for cancer, and his current tremors happened right after that. He had noticed some difficulty with moving prior to that, but he disregarded it. Now he can't disregard it because it impacts all parts of his life. 80% of things in his life are affected. His work, his family life, his personal care. His plans for the future are actually quite bleak, and his doctors have little to offer. He's now diagnosed with Parkinson's. Of course, this didn't happen overnight. When we trace his background, we can see the ugly heads of stress, trauma, and environmental toxins coming into the picture. When he was young, he played with thermometers which have mercury in it. Now, I know most of you are too young to know about mercury thermometers, but they certainly were around when I was growing up. And they did say don't play with mercury because it's dangerous. He also had lots of cavities which have dental amalgams, which is mercury that leaches out into the body. Mercury is neurotoxic, and of course neurotoxic means it's dangerous to the nerves and the brain function. He also worked from age 16 to 20 in an aluminum factory with no protective gear. Aluminum is neurotoxic. It's implicated in chronic pain and fibromyalgia as well. He worked for 4 years in a battery factory, which uses lead. Lead also is neurotoxic. Starting to get the picture? I mean, this developed over time, but this is heavy metal toxicity that's affected him. He also uses cleaning electric motors with carbon tetrachloride for 5 years. It is neurotoxic and carcinogenic. He also had exposure to asbestos and brake materials in the shop he works in. Carbon tetrachloride is a volatile solvent that can cause all kinds of problems. He also had massive IV injections of chemotherapy, which kills all fast-growing and repairing cells in the body. That's what chemotherapy does. Oncologists call it the poisons. We have to administer the poison to patients, but we all know that. It's neurotoxic and immunotoxic. And again, I worked for the National Cancer Institute for 5 years. I know about these things. Oh, I forgot to mention he also was in a car accident at age 6. He was hit by a car out in the street, and he was in the hospital for 3 days, and he had a bad fall from a tree which broke his arm. So these are traumas. So again, the 5 factors. Always have to think about those 5 factors with respect to the body and your health. Now, of course, you might be saying, you know, this can't happen to me. I live in Emeryville. It's green. But the fact is that now we have 100,000 new chemicals in the environment, 200 only of which have ever been studied for medical effects. This is from the California Department of Toxicologists. That's what they said. So we are all exposed, and we are no different from Nelson in that respect. He, like others with chronic and severe medical conditions, has said that he regrets not doing something sooner when it was first noticed. So what are we doing to help him? Well, we're working with things to help his brain, help his nervous system, and his liver. How many of you can afford to let your thinking degenerate? So we're working with him using a new method to ameliorate some of the effects of trauma. On the nervous system. It's called NRCT, and I've given talks on this for quite a number of years. Looking for a particular slide here. It doesn't seem to be in there, okay. We're using acupuncture that also increases neurotransmitters related to stress response and helps address blockages in the flow of blood and oxygen to the nervous system and liver. We use herbal and vitamin therapy to remove heavy metals and toxic chemicals from his body. And we're also reducing the inflammation in his brain and helping his body balance neurotransmitters. So a key question is, how many of you can afford to let your thinking degenerate? Do you think you would suffer like he does? How would that create difficulties in your life or the lives of the people around you if your brain started degenerating? Now, do you think you can actually go to Kaiser or Alta Bates and ask for an evaluation of your neurotransmitters and your nerve function? Do you think you could? if you can, after breakfast, I suggest you make an appointment and go in and get checked out. Because if you do nothing, it's likely that any of this memory stuff will get worse. So it's actually time for a change. Would you like to know if there is an imbalance in your brain that will lead to degenerative problems of your nervous system, such as Parkinson's, Alzheimer's, MS, chronic undiagnosed pain, which comes, dizziness, or diminished sense of hearing and smell? So please raise your hand if you'd like to save more than $50,000 in healthcare costs. Anyone want to save $50,000 in healthcare costs? Well, this is what happens in the future if you don't take care of things now. Long-term healthcare costs go up. So tomorrow is a mystery, today is a gift. That's why it's called the present. So at this point, I'd like to offer each of you a gift. And that's the present. And I'm going to give you a chance to come into the office to assess your health, and with a focus on your brain. Well, where's the brain, by the way? Is somebody? Did everyone get a chance to hold the brain? You want to take care of your brain. And so, so how many of you would like to come in for a free consult? Raise your hands. Okay. Now, this is actually a no-brainer. Very good. You caught that one. All right. So in your file here, there is a stress survey that I'd like you to fill out. And you fill that out and check off at the bottom, I'd like to come to the acupuncturist's office for an initial evaluation and treatment. We also, and you don't have to fill this other one out, but you can either fax it in or bring it in with you to the appointment. This other one, this is called the NTAF. And this form has a lot of questions regarding memory and function that specifically tells us information about your brain and the neurotransmitters in your brain, how well they're functioning. Now, why do I say it might save you $50,000? Well, the most common cause of bankruptcies in the U.S. is due to medical bills that cannot be paid. More than 80% of medical costs go to chronic illnesses and end-stage medical and hospital care. If you could avoid that, I'm sure you would all like that as well. Procrastination is like a credit card. It's lots of fun until you get the bill.
That's so true.
So I want to thank you all for listening to my presentation here. And if you are interested in the free consultation, I do have a few appointment times already set up, and they're in these envelopes in the back here. Inside the envelope is a sheet that says when the appointment time is. And we also have a health history questionnaire form that I'd ask you to fill out in advance, as well as the other surveys. And there's a map, a location where we are in Berkeley. Everyone know where Telegraph and Ashby are? That's what we're like. Just across the street. So if you want one of these appointments that I have available, write your name in on this orange thing and your phone number. And then you'll hand this to me. But this is a free consultation. It can cost as much as $250 to $400 in other offices. But I'm offering it for free. But there's the caveat. You have to give me a $15 donation that's going to go to charities here in Emeryville. Right? It could be the Emory Ed Fund. It could be, I don't know where, but we'll figure out a good place for it to go. But it's $15, but it's not going in my pocket. It's just to give you added incentive to show up. The bread project, sure. We'll give it part of it. We'll do a third the bread project, a third it, and we had fun. All right. Thank you.
You hear all the time in the news the term obese,
Yes.
obesity,
Yes.
and there's an epidemic of it. Can you define this sort of clinical definition of what is obese versus someone who's just grossly
Yes,
overweight?
yes.
What is that definition?
So there's a difference between being overweight and obese, and the total 70 to 80% is overweight and obese. All right.
It's both.
No, it's both together, but there is a thing called the body mass index, BMI, and it's a scale from about 12 to 45. And so from 19 to 24 is considered to be in the healthy range. 24 through 29 to 30 is overweight, and then above 30 is obese. Okay? And there's a chart that has height on one side and weight down the other, and you just match them up. It doesn't always correspond to the individual. For example, do you know Evander Holyfield?
The boxer?
Yeah, anyone heard of Evander Holyfield? So his BMI is actually 45. But he's not obese. He like has about 7% body fat. And so depending if you're really muscular, that adds to your weight compared to your height. So it's quite possible you can be very muscular and still have a low BMI. It's close, but that's pretty much the standard. They took this way to figure that out. And online, I do have, on YouTube, I do have one of my lectures, the longer lecture that I gave at the Emeryville Senior Center on weight loss and obesity that I just gave in January. And that's on YouTube in about 7 or 8 parts, so you can watch that. And in there is a BMI chart that shows that. And also online, you can go online to my website, and it has a BMI chart that you can download and figure out your own BMI. Great question. Excellent question. Thank you. Any others? All right, great.
Okay, thank you very much.
Thank you.
That's great.